Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic for the Appalachian Highlands for the week of August 16th. As I've shown you before, the week-to-week cumulative growth in the death rates in our country is leveling off somewhere between 4.5% and 5%. We'd like to see it come down to zero, but this represents the fact that it's spreading into different parts of our country. If you look at Virginia, it's doing about the same as the U.S., perhaps leveling off slightly lower, which is a good thing, perhaps 2 to 3 to 4%. We'll have to keep our eye on that and hope it stays down, because if you look at the number of cases in Virginia, it rose, came back down, and rose back up again. But there's an interesting pattern with deaths, and that is in Virginia, there was a quick surge in deaths. It seemed to drop, it came back, it came down again, it came back up again, representing sort of three separate waves. And I think what we're seeing there is as the pandemic is evolving into different parts of the state, we're seeing more deaths. So this is a map of Virginia, total cases, confirmed cases as of August 13th. These are the confirmed cases in the past 2 weeks. And if we superimpose this, that's the cases that we've had to date. And then this is the ones in the past 2 weeks. And what you can see is a growing spread of the disease into more rural areas. This is a good sign in the sense that it means hopefully that we're going to be passing the spreading phase. But we'll have to keep an eye on that. Tennessee, unfortunately, we're not seeing the same kind of pattern. It is leveling off, but unfortunately, it's leveling off somewhere between 10 and 15%. That means every week we're getting 10% more deaths than we've had the week before. That's a significant growth rate. If you look at total cases, again, in Tennessee, we saw a slow growth and then an upsurge, and perhaps now it's coming back down. But in terms of deaths, it's been a gradual increase over time. Again, if you look at total cases and cases in the past 2 weeks and we superimpose, there are the total cases largely in our urban and peri-urban areas. And then in the last couple of weeks, we're seeing this spread into more rural parts of the state. Again, hopefully we're going to pass the rapid growth phase. If you look at Northeast Tennessee, we've seen an increase in both cases and hospitalizations. Now, the last couple of weeks, we've seen a drop in cases. We don't know if this is because there's less disease or less testing. We'll keep an eye on that. In terms of the total of Central Blue Ridge region, again, it looks like it may be leveling off a little bit. If you look at total confirmed cases, though, over time, it has been growing. Last week it was at 25,000. This week at almost 29,000. 11% growth, 12% growth in the past week. That's really quick growth. In terms of total deaths, we've seen the same kind of pattern now with 425 deaths in our region and a 20% increase. And so again, it looks very much like Tennessee, perhaps even a little bit worse. Again, as I showed you before, Tennessee has been dropping down and leveling somewhere in the 10% range. Again, not good. But if you look at our region, it went up and then it came back down, but now it's been growing again. And now we seem to be in somewhere in the 15 to 20% range. So clearly we're in the grip of the evolving pandemic right now. If you superimpose the three maps of North Carolina, Tennessee, and Virginia, you can see our area has a lot of dark counties. This is growth in the last couple of weeks. So again, we're in the midst of an evolving pandemic. It is impacting our states and our region pretty significantly. Tennessee's had 132,000 cases and 1,300 deaths. Virginia, 106,000 and 2,300 deaths. In our region, 28,425 deaths. So the way to think about this is an evolving pandemic that's spreading into our states and into our region, and hopefully we'll be seeing a peak relatively soon, but we won't know until we see it. A great deal more information about COVID-19 on our College of Public Health website. Please feel free to go to this, click the icon, and you can see lots of other videos. Many of you have said that you share these videos with others. Please share them as widely as you'd like. If you or others would like to be added to our listserv, please contact Janet Stork at this email or that phone number. And if you have any specific questions or would like to see us cover other issues, please don't hesitate to let me know. I'd be happy to try to find an answer for you. Thank you very much.